My name is Lisa Macknair, and I'm a PA at ReadyMED Medical Group in the Same Day Services Department. You can often find me at the ReadyMED in Milford, and I'm here to talk with you more about Lyme disease. Lyme disease is an infection caused by a bite from an infected deer tick. Deer ticks can be found in the New England, the Mid-Atlantic, and the North Central region of the U.S., so being in Massachusetts, we certainly are susceptible. The way the deer tick spreads the infection is by biting and attaching to its host. And typically it has to be attached for more than 36 hours. And it's the smaller, more immature deer ticks that are more likely to spread the infection. And this is because they're so small that they often go undetected. They can be as small as a poppy seed. The symptoms of Lyme disease that you want to keep a watch out for would include a headache, fever, chills, muscle aches, joint pains, along with a classic bullseye rash. And these symptoms typically develop anywhere from 3 to 30 days after the infection, with about 1 week being the most common duration. The diagnosis of Lyme is typically a clinical one that we make when a person comes in with the classic symptoms, including a bullseye rash, plus or minus a history of a tick bite. Now, sometimes the diagnosis may not be as straightforward, and this is where blood work can be really helpful at helping us make the diagnosis or excluding Lyme disease. The treatment is with a course of doxycycline, which is an antibiotic that a person would take for anywhere from 14 to 21 days. And thankfully, when it started early on in the infection, patients often go on to recover fully and rapidly. What I like to stress to my patients is the importance of prevention, wearing insect repellent with 20 to 30% DEET. You can pre-treat your clothes with permethrin spray, and I do recommend doing tick checks after having been outside. It's also important to check your pets too. When you do get a tick bite, they can be easily removed. You just would want to use some fine-tipped tweezers that you attach to the tick as close to the skin as possible. And then you would pull upward in an even and steady motion. After removing the tick, just clean the area with some warm soapy water or alcohol, and that usually takes care of it. Sometimes patients do worry that the head of the tick may still be left in place. And studies have shown that if the body of the tick is removed, the tick cannot go on to transmit Lyme disease. So if you think that the head could still be in place, it is of less concern for spreading Lyme. At ReadyMED, we often do see people after a tick bite that meet criteria for prophylactic treatment. And this is a one-time dose of doxycycline that, when started within 72 hours of the tick bite, can help prevent the development of Lyme disease. So that is it for today. I hope you found this information helpful in navigating tick bites this season. If you have any questions or concerns, please come into your local ReadyMED or follow up with your primary care provider. We'd be happy to answer those questions for you. Thanks. Have a nice day.